TLDR, Cobra, nah. Marketplace plans, maybe, but iffy. Off-exchange options, health share ministries, worth a look, completely out of pocket. Unfortunately, health insurance tends to be one of those damned if you do, damned if you don't situations. But usually it's a lot more damned if you don't. So let's hike up our pants and jump on into all of these wonderful options for self-employment health coverage. Here we are at the third and final installment of my three-part series covering the trifecta of trepidation. Maybe I'll add a little filter to this. Maybe not. The big three benefits boogeymen that keep self-employed folks up at night. In parts 1 and 2, I talked about sick leave and taxes and some other stuff. And I've saved the worst for last, health insurance. Seriously though, if it wasn't for my apprehension around potentially losing health coverage, I probably would have left my full-time job like 6 months earlier than I actually did. But this sucker kept me from pulling the trigger. But now that I'm on the other side and relatively unscuffed, I can say it's really not that big of a deal. At least not for me. Hang on for a second. Okay. I'm going to try to keep this one short and sweet, primarily because there are so many different options. The landscape is constantly changing. And more importantly, your specific situation, your family, your income, your medical needs could be very different than my own. And because I don't know if you need prescriptions, I'm not going to get overly prescriptive with which health options you should choose, if any. I'm simply going to lay out some of the main healthcare options self-employed folks may want to consider. I also have a couple bonus money-saving tips. I'll give you one right now, and before you even start shopping for health insurance. If you have kids, check out CHIP. That is the Children's Health Insurance Program. It's a government program that provides free or low-cost health coverage for children of families who make too much money to qualify for Medicaid, but not enough money to pay the full price for health insurance. So, like, everyone. It varies state by state, what is covered, who is eligible, and how much it costs, but at the end of the day, most people don't pay anything. And the coverage is legit. My kids are on state insurance now, and I believe they have access to better options than they did when they were on my employer-sponsored health plan. Your mileage may vary, but I would highly recommend you at least check out CHIP. So now that we only have you to worry about, and maybe your spouse if you have one of those, what healthcare options are there for us little chickies stepping away from the warm roost of our corporate hen mamas? The first option your HR rep will probably talk to you about is Cobra. Mad respect to whoever worked out this acronym, because Consolidated Omnibus Budget Reconciliation Act is not as nearly as cool as it sounds. Nor is it clear what it actually means. All you need to know is it's a really expensive stopgap insurance option. It allows you to continue your existing coverage for another 18 or 36 months, but you have to pay 102% of the premium. I could see it making sense if you have an ongoing health condition that you're receiving treatment for and you don't have any alternatives lined up yet. But otherwise, just about any other option that we're going to cover now is going to be more affordable, so let's just scratch this one off the list. Next stop is the healthcare marketplace. That's healthcare.gov or your state's own exchange. In Pennsylvania, we have Penny. In Delaware, I think they have Delhi. In Colorado, it's Kali. Hawaii is Hawaii.
I can do this all day.
Marketplaces or exchanges are a good bet for a lot of people seeking non-employer sponsored insurance, but let's get a running pro-con list up on the screen. Pro, they're easy to navigate and compare all the different options. The main difference from plan to plan is primarily the price. The services that are covered are going to be pretty much the same from plan to plan because every plan has to adhere to the Affordable Care Act guidelines. There's a pretty comprehensive list of benefits that all plans need to offer, from maternity care, coverage for pre-existing conditions, mental health services, and more. Which is nice, if you need it. But obviously, comprehensive health coverage doesn't come cheap, but most people are eligible for subsidies on these exchange plans. And the American Rescue Plan, that's a COVID relief package that was passed a couple of years ago, further reduces the costs and extends eligibility to even more people. So find your marketplace and plug in your information, your family size, your income, your age, and it should spit out your estimated savings and the average plan cost. Shopping on Penny, if we brought in $62,000 a year, and that's the average self-employed salary according to payscale.com, my family of 5 would only have to pay about $100 a month after savings. Up the household income to 80 or 85 grand, we're paying closer to $300 a month, and that's closer to what my coworkers were paying for their employer-based health coverage. It's not until I hit $115,000 do I see the discounts completely disappear. So there's a lot of runway here, but there's 2 critical things we need to understand about these discounts. 1, the extra subsidies from the American Rescue Plan are set to expire at the end of the year. And when they do, according to a report by the U.S. Department of Health and Human Services, most people can expect to see their premiums double. Bummer. Still manageable depending where you fall in the income tax bracket, but that leads us to our second flag on the play. These benefits are paid as an advance premium tax credit. What that means is if you expect you're going to earn $62,000 this year, you're eligible for a certain amount in tax credits. And you can hold off and collect all of that in one big lump sum when you file your taxes. Or if you're like most people, you can have that paid every month to the insurer. If, like most people, you opt to have the tax credit paid in advance to your insurer, you only have to pay $100 or so out of pocket each month. And if you did, in fact, earn only $62,000 that year, you're good. But what if you kill it this year and your business takes off and you end up bringing home a lot more bacon than anticipated? Based on your final income at the end of the year, you might discover that you're eligible for a much smaller credit or none at all. And you'd have to pay back any excess that you'd receive. But you didn't actually receive anything, your insurers took it. So you're left scrounging in couch cushions. And this is why I decided not to go this route. I'm a budgeter. Or I try to be, and self-employment is already riddled with uncertainty, and that just didn't sit well with me. So there's private off-exchange insurance to consider. If you don't want the full comprehensive coverage that you'd find on the marketplace, and you're pretty healthy, you don't go to the doctor that much, you can shop around for low-cost accident insurance or something like a hospital indemnity plan, which is there to just help soften the bill blow in case of an emergency.
Incineration.
I said bill blow. I'm recording Hobbits. And then there's insurance alternatives such as health share ministries or health share communities. Typically, these are faith-based organizations that require their members to agree to a statement of faith or to live in accordance with certain beliefs. But there is a growing number of non-religiously affiliated health share options as well. Typically, you pay a contribution or a share to be a part of the group. Then, as medical needs arise, you can submit a request for a reimbursement or have the organization pay the bill directly. Costs are much less than traditional insurance, but so are the number of eligible procedures and services. Pre-existing conditions or maternity care might require a waiting period or might not be covered at all. And if you need medical attention as a result of something you did that falls out of line with the community guidelines, like you got lung cancer because you were smoking, or you got hurt in a car accident because you were driving under the influence, you'll likely be denied any coverage. Some plans don't cover preventative care, only emergency procedures. So be sure to research closely what is and is not covered, and any limitations on how much and how often you can request a reimbursement for certain services. But if you're reasonably healthy and your beliefs align with those of the organization, it might be a good choice for you. And that's what my family and I landed on. After researching different options, we signed up for Unite Health Share Ministries. It's not an insurance company. They're very clear about that, but it's structured very similar to conventional insurance. In fact, if you look at their brochure, it looks a lot like a health insurance brochure. They just change the names of some stuff like consult fee instead of copay or annual member care share instead of deductible. I guess insurance companies own these words or something, or they're just being very careful not to misrepresent themselves as an insurance company. I'm paying roughly the same amount for health coverage now as I did when I was employed, and it's working out so far. That's really all I can say about that to personally advocate for it. Of course, you can forego insurance altogether, which sounds like a terrible idea. But if you only go to the doctors once or twice a year, you'll probably end up spending in total less than you would for 1 month's worth of health insurance premiums. And doctors usually love it when patients pay in cash because health insurance companies make them wait months to figure stuff out and then finally cut them a check. So if you offer to pay them directly, they'll probably offer you a steep discount. Of course, you could find yourself in an emergency room or develop a severe health condition. And without health insurance, you could get saddled with thousands and thousands and thousands of dollars in medical debt. So having some sort of safety net is a pretty good idea. I teased a second bonus tip at the beginning of the video. Whichever direction you end up going in, don't forget you can deduct insurance premiums as a business expense, asterisk. So long as you're not eligible for health insurance through an employer or your spouse's employer. So if you're just side gigging at this point, one, you probably didn't watch this far into the video, or if your spouse is employed and she is eligible for a family insurance plan, then this won't work for you. But in many cases, if you own your own business, you can deduct health insurance premiums from the amount that you would pay yourself and thus lower your taxable income. And this got me thinking, there's some other money maneuvers you can make, from leveraging health insurance premiums and other business deductions, HSAs and retirement contributions, and employer matching retirement contributions if you're an S-Corp. There are ways to significantly reduce your final tax liability and thus have a little bit more control over that frightening possibility of earning too much and finding yourself having to pay back a ton in those advanced premium tax credits. So I'm going to crunch some numbers and reevaluate some of these options. You go ahead and consult with a tax professional or reach out to a health insurance broker, because there are people out there who are all about connecting people like you with the right health plans for their specific medical and financial situation. I just want to do a quick drive-by of the different options that I evaluated and considered while I was prepping to jump or slow crawl into self-employment. I know it's scary to face losing the stability and the benefits that often come with a traditional 9-to-5, but they're replaceable. What you can't replace is the time you spent feeling like you're not doing what you really ought to be doing. You can't replace the time you spent commuting to a job that pays well but costs way too much in lost dinner times with family. Sometimes traditional employment is the right choice for you and your family. I'm not going to knock it that hard. But if you know it's not the right choice, if you know you're meant to do something different, then please don't let all of this stuff hold you back. I figured it out. You can figure it out. Take some time, take some notes, seek out counsel, and start building your very own self-employment benefits package, because the benefits of self-employment are totally worth it. Thanks for watching. I'll see you in the next one.